How do you manage a dog's cough related to a heart murmur? If your furry friend has developed a cough and you suspect it may be related to a heart murmur, you might be wondering how to handle this situation. Let's break down the steps you can take to manage this condition effectively. First, it is essential to understand that a heart murmur is an unusual sound caused by turbulent blood flow within the heart. This can indicate underlying heart issues, such as myxomatous mitral valve disease, which can lead to congestive heart failure. During a routine veterinary checkup, your veterinarian will listen to your dog's heart and may grade the murmur on a scale from 1 to 5. A murmur alone does not confirm heart failure, so further evaluation is necessary. Next, diagnostic imaging like chest X-rays and echocardiography will help assess the heart's size and function. These tests can reveal if there is fluid in the lungs or if the heart is enlarged. Your veterinarian may also monitor your dog's sleeping respiratory rate. If it exceeds 35 breaths per minute while resting, this could indicate heart failure and requires immediate veterinary attention. It is also important to differentiate the cause of the cough. Not every cough in dogs with heart murmurs is due to heart failure. Coughing can occur from airway irritation, especially if an enlarged left atrium is pressing on the bronchus. Other causes like infections or allergies should be ruled out as well. If your dog has a significant murmur, especially if it is graded 3 or higher, treatment may be necessary. A medication called Pimobendan is often recommended. This medication helps improve heart function and can reduce coughing by alleviating pressure on the airways. Studies show that Pimobendan can delay the onset of congestive heart failure by about 15 months. In some cases, additional medications like ACE inhibitors may be prescribed to help manage heart disease. Diuretics, such as furosemide, may be used if fluid builds up in the lungs, helping to improve breathing. For dogs with milder murmurs, treatment may be monitored closely without immediate intervention, with follow-up radiographs every few months. Supportive care is also vital. Regularly monitor your dog's respiratory rate and watch for signs like increased coughing, difficulty breathing, lethargy, or loss of appetite. Keeping up with regular veterinary checkups is essential to adjust treatment as needed. Limiting excessive exercise and stress can also help reduce the workload on your dog's heart. Managing a cough related to a heart murmur requires careful evaluation and targeted treatment. Early diagnosis during routine wellness exams is key to starting treatment before severe symptoms develop. This approach can improve your dog's quality of life and longevity.